Centers for Disease Control reporting that food allergies in children increased by 50% between 1997 and 2011. Why? Well, let's get some answers. Today we've got Dr. Joel Hartman from Allergy Partners on the phone to talk about important information concerning these allergies. Good morning, Dr. Hartman.
Good morning, Brad. Thanks for having me.
Glad to have you here. Okay, so let's talk about some of the symptoms. I think a lot of parents are very cautious when it comes to food allergies. What are the things that parents need to watch out for?
Yeah, I think the first thing is kind of setting, what happens. Food allergy occurs when the immune system overreacts to a particular protein that's found in that food. And in general, allergic reactions occur within minutes of eating the food, though can occur hours later. Symptoms can be mild and include hives or red, itchy skin, stuffy or itching nose, sneezing, maybe itchy, watery eyes. You can also see vomiting, stomach pain, diarrhea, and even swelling. In some instances, food allergy can cause a severe reaction known as anaphylaxis, which can be life-threatening. And symptoms that could be severe include hoarseness of the voice, tightness or lump in the throat, wheezing, tightness in the chest, trouble breathing. You can also get, in severe instances, low blood pressure, which can lead to dizziness and passing out.
That's incredibly serious. So what types of foods are we primarily looking at? Where do you see the most reactions?
Yeah, in the United States, 8 foods account for the majority of food allergy reactions. And those foods include cow's milk, eggs, fish, peanuts, tree nuts, shellfish, soy, and wheat, although allergy to sesame is becoming an emerging concern.
So those are ones that we often hear of peanut allergies, but you've given us this long list, and these are all ones that I guess parents and caregivers need to be sensitive to, right?
Absolutely, yes. Those, again, make up the majority of food allergy reactions.
Okay, so as a child shows a reaction, is this something that changes over time? Will a child outgrow something like a food allergy?
Yeah, the food allergy can be outgrown, and we know a fair amount about certain foods and the rate at which they're outgrown. For instance, allergies to cow's milk, egg, wheat, and soy will often resolve in childhood. Though there are some signals in the literature that suggest that children may appear to be outgrowing these foods at a slower rate compared to years ago. Allergies to peanut, tree nuts, fish, and shellfish are less likely to be outgrown and could potentially be lifelong.
Absolutely a concern. You just kind of don't know when the process is happening. We've heard about something called desensitization. You tell me. Sensitization, desensitization. Well, there's a lot going on there, but talk about that as a therapy or something that you study. Is it something that works in some kids or all kids or what?
Right, so it's something that's near and dear to my heart. Food desensitization really refers to an emerging therapy for food allergy. Just within the last couple of months, we now have the first FDA-approved treatment for food allergy, and that's a peanut capsule. So let me tell you a little bit about how food desensitization works. First of all, there are numerous studies that indicate that select patients who have food allergy may be successfully treated with this type of therapy. And what happens is food that folks are allergic to are given in small amounts, and those amounts are increased very slowly over time. And that food therapy, that food protein, is meant to be continued indefinitely or lifelong. The goal is really to increase the amount of food that triggers an allergic reaction. So this could provide protection against a reaction if that food is accidentally consumed. And although we have an FDA-approved product for peanut capsule, there are other forms of therapy that are currently under active study and show promise as treatment. I think it's really important, though, to recognize that there is no cure for food allergy, that these therapies are really designed to be continued indefinitely. It's also important to note that food immunotherapy, that's what food desensitization is called, is not for everyone, and that reactions with treatment can occur. And again, for that reason, this therapy should be administered only by an allergist trained in managing food allergy and food allergy reactions.
Some great information, Dr.